Hello, and I wish I was able to be there with you in person, or at least by Zoom. However, a live Zoom presentation would have meant the middle of the night for me, as I am presently based in Ottawa, Canada. I will be Zooming in live tomorrow to launch the People's Health Assembly 5. But for now, I'm happy to participate in a recording of another launch of Global Health Watch 6, which is freely available on our Global Health Watch site. There have been 5 previous editions published since 2005 of Global Health Watches. The purpose of each is to present a more explicitly critical analysis of the state of the world's health than that which the WHO annual World Health Report used to be able to say, given intergovernmental sensitivities. And so he had subtitled the first 5 Global Health Watch editions as the Alternative World Health Report. But now that the WHO is no longer producing an annual health report, we dropped the reference to that with Global Health Watch 6. And instead, we subtitled it In the Shadow of the Pandemic, a reference, of course, to how SARS-CoV-2 arose from critical inequities in global health that preceded the pandemic, worsened them considerably, and still remains a long shadow over global health going forward. But I want to emphasize this is not a pandemic book. COVID's long shadow can be found in almost every chapter, but we wanted the book to be a useful tool for health activists now, and as we emerge from the pandemic, as we are presently doing. And so the issues in the book covers is much, much more than just COVID. Poignantly, Global Health Watch 6 is dedicated to 2 people very important to the evolution of the Global Health Watch series and to PHM, Amit Sengupta and David Saunders. We lost both of them in the years between Global Health Watch 5 and Global Health Watch 6, and they're deeply missed. Now, Global Health Watch 6 follows a traditional breakdown used in earlier editions, especially with its first 4 sections. Now, what is new is that this time, we no longer had a concluding section on popular struggles, health activism, and resistance, and instead, stories of such activism are woven into every chapter, with the intent of illustrating what has been done, what can be done, and what inspires activists to continue in their work. The list of chapters on the left gives some sense of the scale and scope of the contents of the book. The first section begins by reviewing the global and economic dislocations of the pandemic as a continuation of 3 existential pre-pandemic trends: widening economic inequities, worsening ecological impacts, and growing movements of people seeking relief from poverty, conflict, climate change, or all 3. It then takes a deep dive into the gender dynamics of these trends before, during, and likely to continue after the pandemic. One of the struggles recounted in that chapter is the green wave, or the green handkerchief movement, that kept the pressure on the Argentinian government to legalize abortion, in which they were successful, at least for now, as no one knows exactly what Argentina's new right-wing president and government will do. For those with a touch of optimism, the 3rd chapter begins with a discussion of the prospects for a post-COVID economy based on health equity, one that challenges the growth consumption model of neoliberal capitalism that is patently unsustainable, and with a discussion of the degrowth or fair growth alternatives, which build upon the more pervasive knowledge of indigenous communities, be they in South America or even in other parts of the world. And in South America, they're known as collectively Buen Vivir, which is literally, it means living well in harmony with nature and community. And as it happens, Buen Vivir is also the theme of the upcoming People's Health Assembly 5. Now, the next section, B, focuses more closely on health systems, beginning with a critique of the ongoing privatization of these systems and debates about whether we should lead with universal health coverage, which is really a financialized concept, or primary health care, with a much longer and more politically critical history. This section also begins to explore some of the critical issues in the health equity benefits and risks of the rise of digital health and the growing monopoly power of big tech, as well as discussing the role of intellectual property rights in creating inequities in global access to vaccines and now in therapeutics, driven by excess profiteering by big pharma. And of course, that was a major, major feature of the pandemic years. But one of the pandemic's enduring shadows remains its impact on mental health, with one of our chapters explores from the vantage of community organization that offers collective assistance to many of those most affected. Our Beyond Healthcare section C, which goes beyond just health systems in the narrow sense, it runs through many of the systemic challenges facing countries worldwide. The return of austerity measures, the ongoing disruption of labor markets, the continuing promotion of unhealthy commodities and public health countermeasures to that promotion, and efforts to prevent the environmental destruction of global extractivism or to promote agroecological alternatives to the industrial model of food production. Now, the final watch, section D, which is a prominent feature in all previous editions, it looks at the different institutions or rules of global governance that shape our possible futures. The World Health Organization remains key to Global Health Watch analyses, as have contributions on trade and investment treaties, and critical attention is particularly given to the increasing role of the private sector, primarily transnational capital and corporations, and private philanthropy, and in how these institutions, rulemakings, and global health governance affect health equity outcomes. So that's the broad overview. We're now in the midst of planning for Global Health Watch 7, which we hope will be available by February next year. It will be shorter. It will be instantly downloadable in chapter or section form, and it will be translated into French, Spanish, and Arabic. Full book versions, like all of the previous editions of Global Health Watch, will still be available, but what we particularly aim for with edition number 7 is a flexible format that will be able to very quickly meet the educational, advocacy, and organizing tools of local and regional PHM circles and global thematic circles. And just a reminder that all editions of Global Health Watch from 1 all the way through 6 are freely available on our Global Health Watch website. And now I'd like to pass the session back over to your chair, and I thank you for your attention.